Hello, friends, and welcome into Outreach Radio Chicago. I'm your host, Michael Mercado, and I want to thank you so much for making us a part of your day. On today's show, Kim Stebbings, the U.S. president of Dysis Medical, joins us today to talk about their new technology breakthrough for detecting and eliminating cervical cancer. That's coming up in just a little bit. You can follow me everywhere in the universe. I'm on Twitter at mmercado2333. Like the radio show page on Facebook at Outreach Radio Chicago. We're on YouTube, so subscribe to me at Mike Mercado 2333. You can see all the pictures that we make on Instagram. Just Mike Mercado 2333 is the way to find us. And of course, go to the website to see all the cool stuff that we're working on mercadoairwaves.wordpress.com. Kim Stebbings joins us next on Outreach Radio Chicago. Thank you for keeping it tuned in to Outreach Radio Chicago. You can find us everywhere in the universe. We're on Twitter at mmercado2333, YouTube /Mike Mercado2333. You can subscribe to us there as well. We're also on Facebook. Like us there at Outreach Radio Chicago. And you can see all the awesome guests that we have had, including the president of Dysis Medical. Joining us again is Kim Stebbings. Kim, how you doing? Welcome back to the show.
I'm doing great, Mike. How are you?
I'm fantastic. Thank you so much for making some time for us again. The last time we had you on, it was a very interesting show. We learned a lot, especially about the most important people in our life, the women in our life. And I think today we want to do another rehash just in case anybody didn't get a chance to hear all the awesome work that you guys are doing over at Dysis Medical. Why don't you just give us a little bit of insight about exactly what you guys are doing over there right now?
Well, we are currently in over 100 sites around the country, so I think we've about doubled since I talked to you last.
Wow.
And this month, I think, is important because it is Sexual Health Awareness Month. And since the cause of cervical cancer is actually a sexually transmitted disease, so hey guys, it affects you too. And it is the cause of not only cervical cancer, this HPV virus, but it also causes throat cancer and anal cancer, which can affect men. So it's actually relevant to both sexes.
How long did it take, or when did it become known knowledge that it was a sexually transmitted disease? When did you guys figure that out? How long did it take experts to really hone in on that fact?
That's a really good question. We started HPV testing probably about 10 years ago, but it didn't really become the standard of care until about the last 4 or 5 years. So there was a lot of research going on because they didn't really understand. And what they found is not everyone, certainly, that gets HPV it actually results in cancer. In fact, about 80 million people have HPV. So obviously we don't have that much cervical or other types of cancers caused by it. And the main reason for that is most people's immune system is strong enough to fight it.
Wow.
So what they found after a lot of research is it's the persistence of HPV, especially in people that are immunocompromised or may have a genetic history where they're just not as able to fight off this virus. And that is really what causes cervical cancer and these other forms of cancer. So the beauty of it is we now test for it routinely. And if you're not getting this test with your pap smear, you should ask your doctor about it, because if both tests are negative, your risk of cervical cancer is extremely low. And I think that's an important message.
What I found interesting in what you just said especially was 80 million people have it, but because of the immune system, it doesn't show itself, or it isn't as effective. Can the what's the word I'm looking for? Can the research and finding out a way to beat the HPV, can that be a road in which we find cures for other type of cancers? Because I find it interesting that this one, we found out that humans can be immune to it, or at the very least, don't show as many symptoms of it. Can that be a road that a rock that needs to be looked under, or is that something you guys are looking at?
That's really interesting, Mike. Great question. There's actually a vaccine now that's given to preteen boys and girls. And that certainly is one way we can prevent it. It doesn't actually prevent every single high-risk form, but the vast majority of them. the ones that are the most cancer causing. So that is one thing that is happening to actually prevent cervical cancer. It doesn't mean you shouldn't still get your regular screening test, because it doesn't prevent every form of HPV, but it does prevent the worst forms. So that's an important treatment or prevention technique. The other one is there are a number of treatment vaccines that are in development. So these would be used on women who already have the abnormal HPV virus or the high-risk HPV virus. And they're still research only. They're in clinical trials. But it's really interesting to see this may be another way to prevent cervical cancer after you get the HPV virus, particularly in young women, because we don't want to treat young women if we don't have to, because the treatment can actually cause infertility. It can cause preterm birth, preterm labor. So the doctors try to be a little more conservative with women who still want to have children. And this may be a potential treatment for those women.
Kim Stebbings, the president of Dysis Medical, joins us today on Outreach Radio Chicago. For anybody who needs more information, to want to do their own research, if anything in here is something that you might need, please go to dysismedical.com. That's DYSIS medical.com. And last time I had you on, Kim, you guys are already making so many strides when it comes to the technology you guys are using. I heard that you guys have this new, what they're calling the next generation of technology. Can you get a little bit into that?
So the next generation colposcope is an advanced cervical imaging system. And the colposcope is simply a way to visualize the cervix. So the typical colposcope looks like a pair of binoculars. The Dysis system is actually an imaging system, so it actually takes movies of the cervix and actually measures this whitening effect that occurs when you have an abnormality, and it quantifies it into a map that is color-coded like a weather map. So it highlights and helps the doctor select areas to biopsy so they can determine where is the worst area on the cervix. So it's just an assistance to them to give them more information. And we currently have a 9,000 patient study going on. A lot of the sites are actually in the Chicago area. And in that study, we're already finding that it detects about a third more disease when doctors use this device as opposed to their old colposcope. So it's quite exciting. We're just getting data to publication now. And so once this is out in the public domain, I have a feeling a lot more doctors will be adopting it. They've just been waiting for this U.S. data.
I believe the last time you were on, you told us that the Dysis system, or at least the plan is, the technology is able to detect things that the current technology that, as you were saying, everybody's waiting to adopt into, doesn't. Is that has that been like a wall that you've had to get over? It's trying to explain to people, like, this is what it does bring to the table. This is how it can help you.
Well, doctors are taught to be very analytical about how they adopt technology. And so the first thing they want to see is research. And we have 8 clinical studies that have been published in Europe, but they want to see it in their colleagues' hands. So, they have a right to really protect patients. They don't want to adopt technology that doesn't work, because unfortunately there is some out there. So they just want to see it in their own hands with their colleagues. And so we're getting to the point now where we've collected data on over 5,600 patients. So we're over halfway through this study, and it already is showing a significant improvement when they add this additional piece of information to their standard exam. So they still do everything they always did. It just adds another dimension, and that's really what we're trying to prove, is that the doctors really, it helps them get better. And that's what technology is all about, right? It's helping the doctor to get better. Sometimes those lesions are very small, and it is just a little more difficult to see with the naked eye, and this just highlights the area so they look at it more closely.
What has been the biggest pushback or the biggest obstacle that Dysis has had to go through when it comes to introducing this? Because people have a hard time with change and having to adapt to something new. Have you guys witnessed anything or have experienced anything that has deterred or have tried to deter or slow you guys down?
Well, it's not inexpensive, so it does cost them some money. And right now, there's no additional reimbursement for the physician to use this technology. So the doctors who've adopted it, and I'm proud to say that there are, like I said, I think 15 or 16 sites in the Chicago area.
Wow.
And the reason they adopted it is, number one, they wanted to do the best thing for women and have the best possible exam they could. But also, they wanted to be able to engage the patient in their own education, and this has a teaching monitor that helps the patient also see what's going on, so they understand better what the doctor's looking at, why they're biopsying where they are, why they may need treatment, why they don't need treatment. And so it just is very reassuring. And so for many of the doctors, that the documentation that this system provides for their electronic medical record and this map that just helps them be assured that they're not missing a small area that could be significant are the main reasons they buy.
And it sounds like there's positive momentum moving forward with the technology and with the doctors and Dysis. All of it seems like it's progressively moving forward. To Kim Stebbings, you personally, what is your goal? Last time we had you on, we want to put this on the record after all this time, all the growth that you guys have experienced. In another 4 or 5 months, the next time we have you on, what are your goals now opposed to what they were before? What do you see at the end of the light at the end of the tunnel?
Well, in the UK, we have been named in the clinical guidelines. And so obviously that's one of our goals, is to ultimately be recommended by organizations for physicians to use this, because for many doctors, that's what they want to hear. They don't want to adopt technology if it's not recommended by their organization. So our ultimate goal is to make this a standard of care, and that takes time, and it takes wider adoption. So right now we're just focused on making sure that we get it out to as many people as possible and make it available to women. And then, and that involves going out to teaching hospitals, which now we have quite a few, getting into larger health systems where, they want to standardize practice. And we have a number of those right now we're working on where they're literally going to standardize to every practice. So ultimately, it's available to everyone. And that's my goal, because we have already found helped doctors find cancers, very small cancers that they visually did not see, and late-stage precancers that are really important to detect so you can treat them less invasively. And that's really our ultimate goal, is to keep a high quality of life and detect these before they become invasive and can't really be treated easily.
Do you have any advice for any woman, man, husband, wife, daughter, son, whatever the case may be, for such a touchy subject? Do you have any advice or anything to tell the people of Chicago, especially since you guys have such a stronghold in the city, that might be going through this for the first time, whether it is to get the treatment or to get, just the test done? There's a lot of stress that goes into it. There's a lot of anxiety. Do you have any advice for somebody who's seen it so much going into this situation?
Well, I personally have had 4 abnormal pap smears, so I know exactly what women go through when it happens. And we actually created a website for women just to give them information that is a little more balanced. Sometimes information out on the internet is quite scary.
Yeah.
So we want to reassure them, because for probably 80% of women who have an abnormal pap smear, it's kind of a false alarm, but it's something that means we need to check you more often, because you obviously have this high-risk HPV, or you've had an infection that could become something more serious. So we definitely want you to keep getting tested according to your doctor's recommendations. And I think the one note that I want to say is just be sure you're having not only a pap smear, but also the HPV test, and have it at the intervals your doctor recommends, because they may be recommending it more often than the guidelines say because you have risk factors that need to be monitored. So just listen to your physician, follow what they say, and don't put it off just because you're nervous or it's uncomfortable. We're all busy. Women are probably the busiest people I know sometimes because they have so many things going on in their life and they're taking care of everyone else. But, as a husband or boyfriend, encourage your favorite woman to be sure they get their pap smear and their HPV test on a regular basis. And what that means is at least every 3 years. If they got both tests, if both are negative, the chance of them getting cervical cancer in the next 3 years is extremely low. But if they've had abnormals, they may have to be tested more often, and some doctors will routinely test somebody annually if they've had high-risk HPV or an abnormal pap smear in the past. So you just have to talk with your doctor and find out what's best for you. If you smoke, you're more at risk. If you have some sort of immunocompromise, you're more at risk. There's a lot of things where the doctor will have your history, your family history may put you more at risk. So just follow your doctor's recommendations and get your screening test. And then if you have to have a colposcopy, find a Dysis center.
Kim, you're awesome. Kim Stebbings, she's the U.S. president of Dysis Medical. For anybody that wants more information, they do some awesome stuff over there, guys. They actually really do care about everybody that they come in contact with. It's dysismedical.com for more information. Kim Stebbings, thank you so much for joining us today on Outreach Radio Chicago. Do you have any last words for anybody listening?
Yes, I forgot to mention that website is abnormalpapsmear.com. abnormalpapsmear.com, and it also has a way to find out where the Dysis centers are in Chicago. So definitely check that out if you've ever had an abnormal pap. It has a lot of great information and hopefully a little bit of reassurance.
That's abnormalpapsmear.com. Then there's dysismedical.com. She's Kim Stebbings, and she has a home here on Outreach Radio Chicago. Please kicking butt over there at Dysis.
Well, thank you, Mike, and thank you for sharing this important information with your listeners. I really appreciate it.
No problem. It's the most important people in our lives. It's our mothers, our daughters, our sisters, our girlfriends, our wives, and you guys are ahead of the curve and making sure that they stay healthy and that they're here to make sure that we, clean up nice and whatnot. So thank you so much to all you guys are doing out there. Kim Stebbings, everybody, on Outreach Radio Chicago. That'll do it for us today, guys. Thank you so much to our guest, Kim Stebbings, the U.S. president of Dysis Medical, for joining us today and giving us some amazing information for all the women in our life, the most important people in our life. If you want more information, just go to dysismedical.com or abnormalpapsmear.com for more information. That'll do it for us. You can follow me everywhere in the universe. I'm on Twitter at mmercado2333. Follow me on Instagram at MikeMercado2333. Subscribe to us on YouTube, Mike Mercado2333. We're on Facebook, like the radio show page at Outreach Radio Chicago, and visit the website mercadoairwaves.wordpress.com to see all the cool stuff that we are working on. One last thank you to Kim Stebbings. Thank you so much for listening to us, and we will see you next time on Outreach Radio Chicago. Take us home, Hav.